Hi, my name is Jocelyn Arias and I will be conducting an orofacial examination on my patient, Duva. Now to start, I will be looking for the general symmetry of the face. There is no visible drooping of the mouth. The eyelids are good. There is no partial or complete closure of the eyelids. There is no drooping on either side of the mandible or the jaw. There are no abnormal visual movements that I see. No facial grimaces, no spasms, no twitching. There are no signs of mouth breathing or drooling. Can you smile, please? The corners of the mouth are symmetrical. They do not droop to either side. There's no deviation. Can you open wide? While the mouth is wide open, there is no deviation to the jaw. You can close your mouth. Can you raise both of your eyebrows at the same time, please? The eyebrows are even when risen. Can you close your eyes tightly, please? Eyes are closed tightly. They are even on both sides. All right, we will be looking at the structure and function of the lips now. Focusing on the structural integrity of the lips. There is no visible drooping at the corner of the mouth. There is an adequate amount of tissue in the lips. The lips remain closed while at rest. There are no visible signs of mouth breathing or drooling. Mouth is closed. The lip tissue appears to be healthy. There is no evidence of a repaired cleft lip or other scar tissue. The lips look normal. Functional integrity of the lips. All right, can you smile for me with teeth? Okay. No, the mouth is even while smiling. There is no deviation to either side. Can you pucker up? Okay. When lips are puckered, they are even. There is no favored side. Can you do quickly 4 times? Perfect. The range of motion appears adequate for speech. The patient is able to pucker and smile repeatedly. Can you puff your cheeks and hold the air and count to 5? Okay. He is able to count to 5 and hold and maintain the air in his cheeks. There was no evident nasal emission perceived. I did not have a mirror, but I could not feel it on my finger. All right, I will need you to, I'm gonna make a sound and you're going to repeat the sound. All right, ooh, ee, ooh, ee.
Ooh, ee, ooh, ee.
Perfect. The range of motion and the strength of lips seem appropriate for the task. Now we are moving on to the structure and function of the tongue. All right, would you do me a favor and stick out your tongue? All right, tongue appears normal. The size of the tongue appears appropriate in relation to the patient's oral cavity. There are no signs of muscle loss or atrophy. There are no visible abnormal movements while the tongue is out. There's no spasms, fasciculations, writhing, or twitches. Moving on to the functional integrity of the tongue. Can you stick out your tongue as far out as possible, please? If the patient was able to perform the activity without effort. Range of motion appears appropriate for speech. The tongue does not deviate to one side. It is perfectly symmetrical and even when outside of the mouth. All right, I'm gonna need you to stick out your tongue for 5 seconds. 5, 4, 3, 2, 1. All right, I'm gonna need you to stick out your tongue and don't put it on your lip for 5 seconds. Don't touch your lips at all. Nope, don't touch your tongue with your lips. All right, no, it's okay. Just stick it out. And yeah. 5, 4, 3, 2, 1. Okay, the patient was able to hold out his tongue protruded position for at least 5 seconds. He was able to do so without touching his tongue to his lower lip. It does not rest on his lower lip. It is completely protruded out. All right, stick your tongue back out. Don't touch your lips. And I want you to move your up and down and then side to side.
Without or with touching?
Don't touch your lips. Go up and down. And, and then side to side. Okay. The range of motion and is appropriate for speech. There was no signs of groping or uncoordinated movement or weakness. When the patient retracted the tongue, it was fine. The range of motion was appropriate. Okay, I'm gonna need you to open your mouth and lift up your tongue. I'm gonna now look to see if there are any signs of ankyloglossia, which is being tongue-tied. There are no visible signs. Can you please repeat for me, la, 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 la?
La, 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 la.
Okay, range of motion, strength, and excursion of the tongue seem appropriate. Can you repeat ka, 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 ka?
Ka, 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 ka.
Range of motion seems appropriate. Can you repeat ka, 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 la?
Ka, 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 la.
Perfect. Range of motion seems appropriate for speech. Now we will be moving on to the structure of the hard palate. All right, so I'm gonna need you to look up, open your mouth, and I'm gonna look at the roof of your mouth, your hard palate. Okay, can you open wide, please? All right, coloration of the hard palate appears normal along the midnight. The height and the width of the hard palate appear within normal range to speech production. Can I see again? There appears to be no signs of repaired or unrepaired clefts. No signs of surgical removal of any portion of the hard palate. And there are no prosthetics, no dentures, no palatal lifts, all normal. All right, now we move on to the structure and the function of the soft palate. All right, same. Put your tongue down. Okay. Coloration of the soft palate appears normal along the midline. Can you go ah? I need to see the back. Okay, thank you. Are there any signs of repaired or unrepaired? No, there are no signs of repaired or unrepaired fistulas or fissures. There are no signs of any surgical removal of any portion of the soft palate, no prosthetics. The velum appears symmetrical. And yes, the length of the velum appears sufficient for adequate posterior movement in the velopharyngeal closure. Now we will be moving on to the functional integrity of the soft palate. All right, I'm just gonna ask you a couple questions and you're just gonna answer them. How was your day today?
Good, and you?
It was good. What did you have for breakfast today?
Quesadilla.
Anything else? What you have for lunch today?
Meat and chicken.
All right. The patient's speech does not sound hypernasal or hyponasal. The pressure consonants are produced correctly. There are no unusual substitutions such as pharyngeal fricatives or glottal stops for pressure consonants. Can you please repeat after me? Ah. But loud enough and wide enough to where I can see your... Okay, thank you. The vela moves up and back to meet the pharyngeal wall. Yes. Okay, I'm gonna need you to repeat the same sound as me again. Ah, ah, ah.
Ah, ah, ah.
Do it again. Okay, perfect. Yes, the vela moves up and back to meet the pharyngeal wall to produce isolated sound syllables or words loaded with nasal sound while placing a mirror under the... Unfortunately, I do not have a mirror on hand, so I cannot do this question. And we will be moving on to teeth and related structures. The integrity of the teeth and the dental arches. Okay, I'm gonna need you to open your mouth like this. Perfect. There are no missing teeth. The teeth are straight. There are no jumbles or tilts or malposition. There are no dentures at all in place. There are no dental appliances in place. No dental appliances in place. Can you bite down gently? Okay. Molar occlusion relationship is normal. The bite relationship of the teeth is normal. General condition of the teeth is normal. Good hygiene, no cavities, no visible breaks. And that concludes my orofacial examination on my patient. Thanks for watching.